Health Minister Dinesh Gundu Rao has sounded the alarm over the alarming rise in Caesarean section deliveries in the state. In fact, the situation has reached a critical point with the overall C-section rate soaring from 35% in 2021-2022, that is, to a staggering 46% today. Private hospitals are the biggest contributors, performing a shocking 61% of these procedures. Now, Rao stressed that private hospitals are increasingly opting for C-sections due to the financial incentives they offer, as they're quicker and more profitable than natural births. However, the health minister, and rightly so, has warned that the trend poses a serious risk to both mothers and babies, as C-sections come with greater health complications. Now, as we speak about this, these complications make C-sections seem like the safer option. Having said that, and as we continue to track this, my colleague Sneha Koshy earlier spoke to Dinesh Gundu Rao, that is the Karnataka Health Minister, on the same. Let's listen into that.
I'm being joined by Karnataka Health Minister Dinesh Gundu Rao. Thank you very much, Minister, for joining us. Good evening to you. My first question: what's the sudden focus on the form of delivering a baby, the process of delivering baby, C-section or natural birthing? How does this really come about?
So, the reason why we want to focus on this is we all know that giving a birth to a child through a natural process is far, far better for the health of the mother and the health of the baby. And we are seeing an increase in C-sections that are taking place in Karnataka. For the last 3 years, if you see the curve, it's gone up by more than 15%. So this is something which is very worrying. And we don't want people to be unnecessarily being made to take C-sections, Caesarean operations. And we want to promote the natural birth. So this is a cause of concern for us. And that's why we're going to come out with a policy next month on how we can promote natural birth of babies. And also, we need to disincentivize the exploitation of doing Caesarean operations.
Well, exploitation of doing Caesarean operations, that's a very huge term. It's a huge allegation, as you're putting it. So are you suggesting a nexus behind increasing C-sex in India, or to be specific, Karnataka, since that's your state?
I won't say a nexus, but what is happening is, in private hospitals, they feel that giving a C-section delivery is also something which they can earn more money. Second thing, it's also very, quite convenient for them to do. Giving birth through a natural process, there is more effort in terms of preparing the mother and trying to prepare her psychologically, physically, mentally for that. So, doing a Caesarean operation is, just like just cutting open your stomach and taking the baby out. So, it's less taxing for the doctors and the staff and more remunerative. And so that is one of the reasons. Second thing is, nobody is really making an effort to promote natural deliveries amongst pregnant women.
Mr. Dinesh Gundu Rao, you almost possibly put it very simplistically, if I may say, but how staggering are the numbers?
See, the policy still has to be, it has to come to paper. It's going to take another few weeks that we're working on. But broadly speaking, we see some of the private hospitals where they are doing C-sections at the rate of almost 80%, 85%. That is unacceptable. If they're doing C-sections at the rate of 40%, 45%, even 50%, I will accept that to some extent. But if a private hospital is doing C-sections at the rate of 80%, 75%, that is not a normal number. So there is obviously something else going on there, one. Second thing is, hospitals also should incentivize the doctors when they do normal deliveries. Private hospitals, I think there should be a method where when they do normal deliveries, also there should be an expenditure, a payment made. Like how a C-section delivery, there's a payment made to the hospital for delivering a C-section.
So, to people who ask, What's the state's business to decide on how a couple or a mother should give birth? What right does the state have? What would you say?
I think definitely it's a state business because exploitation of certain procedures because it is more remunerative and easy at the cost of something which is actually doable is something that the state has to look into. And see, we are looking at two aspects. One is in our own government hospitals. Though the numbers are lesser than the private hospital, there are more natural childbirths in a government hospital than in a private hospital. So, but we are looking into our own system, how we can improve our own functioning, but also at the same time make the private hospitals aware that you should also think along these lines. The gynecologists, the pediatricians, the obstetricians, they should think along these lines of promoting natural live birth. And like I said earlier, if an hospital is doing 80% C-sections, then that is something then that the hospital is purely functioning without really getting into the health aspects of the mother to be. So health is an issue where I think government can definitely always play a role.
All right, as far as we're speaking about Karnataka and in terms of what else we're picking up here, because the health minister has also spoken about another alarming spate of maternal deaths. In fact, maternal deaths have been reported in Bellary, Karnataka, where the government has ordered the audit of the same. With rising cases, like we just spoke about the Caesarean deliveries, now this has come to the fore, and Siddaramaiah government has decided to order a thorough investigation into the matter. Karnataka Health Minister Dinesh Gundu Rao said that a high-level probe will be ordered after reviewing the report by an expert committee. Let's tell you that he further said that a maternal death audit has been ordered, which will help fix responsibility. Taking that to Neha. Neha, what do we know about the details that have come to the fore? Because this is an alarming spate of maternal deaths is what we're given to understand. Of course, action has been promised, but what more can you tell us?
Well, yes, Nivedna, of course, this is probably an incident there that's, now sparked off a larger conversation on, the safety of deliveries that are being, carried out in the state. Now, while, of course, this is a particular incident there that's coming to light from a Bellary hospital, a government hospital there where several maternal deaths were reported. The government, in fact, swung into action. They said that, whether it's the medication that was administered to these women or whether it was to do, with the procedures that were carried out, all of that would be thoroughly reviewed. A committee was formed. They've submitted their report, and now basis that report, the government, of course, is going to be mulling action. Now, if we're talking about, of course, the larger implication that this particular incident, so to speak, has had, we're looking at how the government has decided that there would be some regulation, some control, some monitoring that needs to be done as far as C-section deliveries are concerned. At a whopping 80% is what the health minister says in private hospitals. This, of course, raises a question now about whether there is a lack of awareness and a lack of understanding in women itself, as they go in for their deliveries. That's a very pertinent point that was raised by women activist Brinda Adige as well, wherein she said that many a time hospitals, in fact, pressure the women and the families into C-section deliveries in order to make that extra buck. Now, how is this policy or this program going to come forth, and how is it going to regulate, this whopping number that we're looking at? Well, all of that is something, of course, that, would be rolled out in the coming days.
Right, Neha. Thank you for getting us an overall perspective because it's also, of course, linked at what we're currently seeing with the Caesarean issue as well in the state. Having said that, Neha, thank you for drawing things into perspective for us once again. We're slipping in a quick break here on the